Just cancel your health insurance. That's the answer. I've had the best health insurance for so many years. Since it's open enrollment, it is showing that I have to pay over $2,000 a month on health insurance. So I decided to actually do my homework for the first time because everyone has this scare like I need health insurance. So I called the clinic where I have to do 4 scans every single year, and I wanted to know, what do you charge me cash if I had no insurance? This year I just went like 2 months ago, and the total cost was $465 that I had to pay out of pocket. I'm like, okay, maybe this is like a $15,000 service and I'm only getting it for $465. That's amazing. Want to know what it would cost with no insurance? The total is $550. Literally less than $100 difference. Meanwhile, I've been paying like $1,500 a month on health insurance. Just now it's going up to $2,000 because it's open enrollment. I called all my other doctors to see, do you take patients that don't have health insurance? They're like, yeah, of course. Some of them didn't want to give me their pricing until I said I might lose my health insurance, and they had no option. I called primaries, gynecologists, pediatricians, eye doctors, the whole nine. Every single one of them, less than about $150 per visit. Health insurance is a scam. Get rid of it.
Hi, welcome back to the channel. Thank you so much for stopping by. So we're going to be checking out some videos on health insurance. The health insurance has really gone high. Like, people are taking their health insurance like for 2026. It has gotten so ridiculous and unaffordable for people. People are deciding, like, it's really bad when people are opting out. A lot of people are thinking about canceling their health insurance because the prices are just not affordable. A lot of people are getting like a double increase. We keep complaining already that things are very expensive, and they're now having to face the fact that you have to be paying a ridiculous amount of money monthly. Mind you, it's just 30 days and you have to be paying all this. It's really sad that the prices have gotten so high to the extent where people are wanting to let go of it and cancel their health insurance and rather maybe save up money. We're going to be checking out this video, but before we get right into this video, please make sure you click the like button. It helps with the algorithm and I appreciate that so much. Let's get right into this video.
I just logged into my health insurance provider and I'm in the same boat as so many people. It's absolutely stunning what just had happened. In June of 2025, my insurance went from $125 a month to now $426.84. And now, since it's open enrollment, it's unbelievable. I mean, I'm at a loss for words. It has now grown to $1,164.82. What am I going to do? How am I going to afford this? Do I have to cancel my insurance? Like, what's the way for Americans to get health insurance? What are we all going to do? I'm broke. I can't afford it. It's a sad, sad day.
Okay, so open enrollment is coming up, and we're clearly very qualified to be talking about this.
I am. I'm a genius.
We're trying to figure out if we want to cancel our insurance and pay out of pocket or keep insurance. Bottom line is we're canceling insurance. How much are we paying per month for insurance?
For me and Beckham, it's about $550 a month.
Okay, so we've done all of our research, and Tyler's going to share it with you.
Oh, yeah, me. Just for like a typical blood panel that I have to do every year for insurance through work is $280. Like a women's hormonal test, that would be $289. With insurance, it cost me $190 go in to do an EKG, which took a minute. I could have just done an echocardiogram for $280. The comprehensive panel.
They have sales!
$308 typically, $281 on sale.
Okay, so if it's just like a random Tuesday and you feel like you're kind of getting the flu or something, you can go to Amazon One Medical is $50, Texas Health Breeze is $50, or $205 if you go in office. If you go in office to Texas Health Breeze, they can do x-rays and COVID testing, things like that, just a little bit more comprehensive versus your telehealth medicine. Call on doc, same thing, $30 a visit, or you can pay $45 quarterly, and then it's only $15 every time you need to call them. For children, Blueberry Pediatrics is $30 a month, or it's $216 a year plus a one-time fee for the kit, but I have a code for that if you need it. Both of those are 24/7. We've had Blueberry since Beckham was born, and it's been a lifesaver. I will have that for the rest of my life, as long as I possibly can keep him on it until he ages out. We also found JPS Health. I don't know if that's only a Texas thing or not, but if you make 400% or less of the FPL, the federal poverty level, you qualify for a discount. I think it was like 40% off of your medical bills. I mean, we're not people that get sick very often. Even if I am sick, I'm not going to the doctor unless I'm on my deathbed. So This makes no sense for me. I'm not gonna spend $1,000 a month on insurance when total I would be spending $50 a year if I really went to the doctor when I was sick. You know what I mean? Okay, I did the math. $8,400, which is what Tyler spends in a year on insurance for just him and Beckham, minus $216, which is the cost of our Blueberry subscription, minus my comprehensive blood panel and my hormone blood panel, and 4 telehealth medical visits for Tyler and I throughout the year, just in case. That comes out to $7,414. So, good luck.
Crashing out a bit because health insurance is increasing and I have no idea what to do. So, I was paying $542 a month, which to most people outside of the United States, that's outrageous, that's expensive, and it is, yes, extremely expensive. However, to a lot of people here, that's probably on the cheaper end. What does it cover? It doesn't really cover much because you still have to meet I think it was a $6,000 per person deductible. So that $542 was for me and Alex, my husband. And now it's increased, and it's increased for everybody. So starting in January, it's supposed to be $871 a month. And I am now debating to just not even have health insurance for us because we can't afford that. And then you have this whole thought of you're healthy until you're not, and anything could happen to you, and you have all these thoughts in the back of your head that make you feel like you should have the security of health insurance, because if you were to end up in the hospital, it could cost you $500 grand, and instead, since you have health insurance, you only pay 15 grand or something like that. And of course I would rather pay the 15 grand than the 500 grand. However, $871 a month is just not doable. I don't understand.
Y'all want to hear something wild? I just tried to renew my healthcare and dental coverage and called my current insurance company. They had a little thing on their website that was like, if you don't renew through Marketplace, your plan will automatically renew. But if you'd like to make changes, you can go through Marketplace. And I went to the Marketplace, did my application. My monthly premium, like the cost per month that I was going to pay, went up $500, and my deductible went up $5,800. And I was like, no. So I call my insurance company and I'm like, hey, I saw that if I don't renew through Marketplace, my coverage will stay the same. Everything stays the same and it'll just automatically renew. Is that correct? And she's like, yes, that's correct. You don't have to do anything. And I was like, okay, what about dental? I currently have them like together through Marketplace from last year. She was like, no, your dental is going to expire, so you need to renew. So I go back on healthcare.gov, go to try to renew my dental. It won't let me unless I accept the updated, outrageously, obscenely more expensive healthcare plan for the exact same plan that I'm about to get at the same price just for auto renewing it through my insurance company. So then I call healthcare.gov and I'm like, hey, I'm just trying to renew my dental insurance. And they're like, you can't do that. And I was like, but I'm enrolled in insurance, in health insurance. I just need the dental. And he's like, that's not possible. So I'm about to have no dental insurance because they won't let me, because I refuse to pay $500 extra a month and $5,800 extra in my deductible for next year. I guess my teeth are just gonna have to wing it. This is insane.
Well, it's officially that time of the year in America again, where you get to choose how you would like to get robbed by selecting your health insurance plan. So I'm going to tell you what me and my family are doing to keep us covered, but also keep the most amount of money in our own pockets. Keep in mind, my family is generally in good health, and we are not qualified for Medicare. Unfortunately, it does not work if you are qualified for Medicare. This year, we are going with the high-deductible health plan, which is the Bronze 60, and pairing it with a health savings account. You don't need to know all of the differences between all plans at this point. Just keep listening. Why a high-deductible option? It saves us between $300 to $1,300 a month in premiums. And you must remember that monthly premiums are dollars paid that will never end up back in your pocket. Let's play this out. Instead of paying for a pricier gold plan, where insurance companies will pay a portion of our medical bills sooner, we choose the Bronze 60 plan and save roughly $300 a month. Now we take that money and put it directly into that HSA, the health savings account that is unlocked through getting that high deductible plan. If nothing goes wrong, We get all of our preventative care visits for free, which, by the way, is standard across the board. And then within 3 years, we'll have saved over $10,000 in a medical emergency fund. On top of that, these savings have a triple tax break. The HSA is pre-tax going in, it is tax-free growth if invested, and then it's tax-free withdrawals if used for medical expenses. That's unheard of. And then at age 65, you can actually freely use that as a retirement fund. It's just gonna be taxed as normal income if it's not used for medical expenses. That is literally hundreds of thousands of dollars compounded by the time that you retire that previously would have been wasted away in insurance premiums. Now, what if something goes wrong? Because that's why we have health insurance, right? For us, one of the real tests came when my son needed urgent care for falling on an exposed bolt. We rushed to the doctor, they glued it together, gave him multiple butterfly stitches. It was $65. But now let's say it's a more costly and common accident. You break a bone, or you end up in the ER and you need a CT scan or some blood work. Now at a hospital where I live, a CT scan might run about $1,400. That sounds terrifying, right? But here's where the strategy really kicks in. That's expensive. And for a high deductible plan, you'll pay every dollar until you meet your deductible. And in my case, that would be $5,800. Here's one thing I will not do. Put it on a credit card. No. I call the building department, I ask for their self-pay discount or their financial assistance program, and then I set up a 0 APR payment plan, which will beat all credit card companies by an absolute landslide. And then I find myself with a bill something like $200, $300 a month. Does that number sound familiar? That's the number that I would have been shilling away into premiums, and now that's going towards actual medical bills. So here's your fork in the road. Option A, you're healthy. You can afford a monthly medical bill if it occurs, but you also want to keep more money in your own pocket. So that's where I would go, the high deductible health plan with the HSA. That's what we're doing. Option B, either you expect a lot of medical visits or you just want more predictable costs, then you can go with one of those higher tiers and pay more monthly, but you have lower surprise bills. In this case, one thing that I would suggest is that you should be comparing using the summary of benefits document that is provided by insurance companies to compare costs of the services that you expect to be using, not just the basic summary. And again, if you need any more help, drop a comment, follow for more. I'm always here.
Honestly, opening a renewal letter is like a horror movie. At this point, honestly, the only people that can afford healthcare is really maybe billionaires, celebrities, and maybe, I don't know, somebody who's just like really wealthy, because apparently peasants cannot keep up. We can't keep up with what's going on because nobody's getting a lot of money like that. Like, we're not getting much money. But then at the end of the day, every little bill that you're supposed to pay monthly just seems to be so ridiculous. Cost of living is extremely high, and then now you're like, what the hell is going on? It's just too much.
I'm like so mad right now. If you own your own business in the US and you don't have insurance through a spouse, then how the fuck are you affording it? I own my own business and so does my husband. Our health insurance is going up to $2,000 a month for me and my 2 kids in January. And sorry, but that's just not possible. That's just not something that we can pay. Like, I just don't have an extra $2,000 a month to spend on health insurance. Like, that's just not a thing. And this is going through the marketplace. This is going through the one that the government has set up to help people, because my husband lost his job last year. He started his own business this year. I have my own business. Like, that is just wild. And that's for shitty insurance. That's not even like good insurance. That's the bottom of the barrel insurance. So you're a business owner. Do you just pay that out of pocket? Is that what you're doing? Or is there something else? Am I missing something? Do you just not have insurance? Because I'm pretty sure that's the path that we're going to be going. We're not going to have insurance, and then we're just going to have to pay out of pocket when we go to the doctor. So essentially, we have 1 more month of insurance. So everybody's going to go to the doctor. Everybody's going to go to the dentist. Everybody's going to go to the eye doctor. And then when we go, we're just going to pay it out of pocket. Because the last time I went to the doctor with my kids for just a regular checkup, the payment I had to pay was $250 anyway. It wasn't even like it was a $20 copay. It was $250, like ridiculous. So what's the point of insurance? I know it's a scam, but how are we working around the scam system?
So just curious, did anyone do their benefits for 2026 yet? Like their insurance benefits? Because I did. So I used to pay about $82 in medical. This is just for me, $82 in medical, like $12 in vision and like $8 for dental or some shit, right? Okay, whatever. The numbers might be a little foggy, but I was paying like less than, like less than $200 for my insurance plan. So now I just added my daughter to my plan for 2026. Yo, for me and her to both have dental, medical, and vision insurance, the new price, just a little under $400 every paycheck. I'm sorry, what? I might as well just pass away right now because I don't know how I'm gonna do it. I really don't. I'm really sitting here like, wow.
I'm a senior benefits analyst and I want to share some resources for those who need healthcare. If you don't have insurance, or even if you do, save this video, and I'm so serious because everyone needs access to affordable healthcare. The first one is completely free Remote Area Medical, RAM. They are a nonprofit. They have pop-up clinics that offer an array of free medical, dental, and vision benefits. So pap smears, glasses, dental work, prescriptions, and much more. These are real medical professionals that are basically volunteering their time to help out the community. You can find schedule and locations at ramusa.org/schedule, and be prepared to arrive early because, as you can imagine, free resources, everyone wants to take advantage of those, and some people might even come early and camp out, but it's worth it. Community health centers offer health services to the uninsured. There are going to be copays, but they vary and they're likely going to be low cost or income based. You can find one near you, just Google it and call to ask about pricing before actually booking. Dental hygiene schools or dental schools offer very discounted or even free cleanings, fill-ins, extractions, checkups, etc. This is a great resource. If you don't have dental insurance, I've used it myself. With Amazon Prime, One Medical gives you access to doctors and prescriptions if you don't have insurance for less than $100 a month. This is usually telehealth, but if you live in a place where they have physical locations, then you can always go in person. GoodRx also has the same kind of membership. Theirs is called Minute MD. Another option is to find out the cash amount of the service that you're trying to get, because sometimes it is cheaper to pay cash per instance instead of paying for health insurance monthly. Some doctors don't always take insurance, but they do offer a membership. So you would pay maybe $80 to $150 a month to get access to the doctor, depending on the terms that they outline. This is called direct primary care. So just look it up to find if there's any offices that offer this near you. Also, $150 a month is way cheaper than any insurance that you will find right now. Vision is usually pretty cheap, but every penny counts. Student eye institutes usually offer discounted or even free prescriptions, glasses, and optical exams. Sam's Club also has good eye exam and glasses packages. And if you already have the prescription for your glasses and you just need to order the glasses, you can get this for a discounted price on Zenni.com or Zlaw.com.
I know I must have said this 1,000 times, but most of the time they give you like explanations talking about some vague explanations about, oh, this rising cost and this and that. By the end of the day, I feel like I keep saying this, okay, like if you guys are raising the price of things, right, and they are unreachable for people, then specifically, like, I just don't get it. Like, what if you're talking about rising costs? Are you really paying people who are working for you? Are you paying them a lot? Like, are you increasing their pay? Because I need to be hearing a lot of people actually coming outside to be like, oh, you know what, our paycheck has increased. Oh, because you definitely have employees, like people working for you. I need to see a lot of people coming out to say, oh yeah, we got like a lot of pay increase. Like, I got this percent, I got this. I don't want to hear people talking about they got like some 2 cent increase or 3 cent increase on their paycheck. And then, like, because you're talking about rising costs, what is really rising? Because apparently you're not paying the people that are working for you, it's not costing you much. Matter of fact, these companies are out here outsourcing to other cheaper places, hiring people who they pay less money to. So I just don't get it. Like, what's the whole thing? Like, why are, like, are they just pushing it too far to just see how far people can accept or take all these things? This craziness that I'm seeing, the craziness that I'm seeing with this renewal is just out of this world. I just don't know where we're heading to. Generally speaking, I don't blame people who are opting out of it. Like, because if you know, if you know you're healthy, yes, you should save some money. Just make sure you save a lot of money in your bank accounts just in case of emergency medications and stuff. For emergencies, I think definitely they'll have to take you in. But you guys, be safe out there. You've made it to the end of this video. Thank you so much for watching this video to the very end. Please make sure you click the like button. It helps the algorithm and I appreciate that so much. And hit the notification bell to get notified every time I post a new video, and leave your thoughts in the comment section down below. Subscribe to the channel if you're new here and you're watching me for the very first time. I'll see you on the next one. Bye.